I went to see a patient with breast cancer. I recommend her to be treated. She doesn't care because she doesn't want to lose her beauty. But when I talk about whitening, she said, Dr. Kampon, go ahead and do it. To me, it doesn't make sense. It's actually the gift from God. I think that God created stem cell.
Is it the same way all over the world right now? And why do you think that is? Like, why are we not allowed to talk about stem cells and tell people where to go?
I brought a new doctor here for you to meet because I have to say that this is really the father of stem cells in Thailand. I will say that Dr. Kampon is kind of like the Andrew Weil that you would have known in America. And he wanted to introduce all of his complementary therapies in this country, so he started bringing doctors from other places to bring a knowledge base here and started developing clinics one after another to start changing a wave of medicine through this country. He is the beginning of the paradigm shift, the first stone that dropped. So I brought you here because there's a lot of things he's doing with stem cells that I think you might be interested in asking.
Well, it's very nice to meet you, sir. I
Nice to meet
really
you.
appreciate you taking the time and effort. I know that you're very well regarded around the world.
Thank you very much.
When it comes to stem cells and many other things as well. What made you decide in your life to start studying and producing and doing the research on stem cells?
Well, I have to tell you a bit of my background. I actually a professor in medical school. So I was trained in conventional medicine. And I've been changing my mind when I started to treat cancer by chemotherapy and radiation. Even though I think it's necessary to treat cancer, but the way to use cancer chemotherapy is not the right way. Because once you destroy cancer cell, normal cells are easier to kill. And that's why we have a lot of complications. So I start to look back that what I'm doing may not be in the right way. So I turned my life around by learning more about what causes cancer and how we can prevent it. And that's the first area that I come into something related to stem cell. Because I think about immune system. As you probably know, NK cell, dendritic cell, T cell, B cell. They are the most important weapon that nature created for us. Why not use it? After that, I learned that when we treat diabetes, for example, we give them many drugs, many things, but hardly a few really indeed of the patient can control their blood sugar very well. So that's why I start to come to learn more about cell and stem cell. Even in medical school, I think we have not been taught enough to look at patient in holistic point of view. I learned to change a lot. I used to be, most doctors do, become a dictator, like you must do this, and don't come to see me. But I know that each one have their own idea. I can give you a few years ago, I went to see a patient with breast cancer. I recommend her to be treated. She doesn't care because she doesn't want to lose her beauty. But when I talk about whitening, she said, Dr. Kampon, go ahead and do it. To me, it doesn't make sense. But I realize that we have different point of view. This kind of women, beauty become their first priority. And for men, even though I do not recommend people to be sexually active, but I know that most men, they prefer to have sexual power. So I learned to change from that. And that's why when I come to stem cell, I think that we have to realize that it's not the good scientists and doctors like me who are good. It's actually the gift from God. I think that God created stem cell. And scientists like me, I think different. I just learned that how can I collect the stem cell properly, which follow the good legal practice and ethical guideline. So therefore, I have been concentrating more on the idea that let's start with stem cell first is nothing new. Has been created long time ago. And as we all know, bone marrow stem cell has been discovered since the year 1962. And bone marrow transplantation has been used starting from the year 1969. That's almost 50 years ago. After that, we learned that stem cells exist in our peripheral blood. And on the year 1989, a French doctor discovered that stem cells exist also in the cord blood from the newborn baby. So therefore, we start to have different terms like hematopoietic stem cell and all that. But what makes the world exciting is the discovery of so-called embryonic stem cell. At that time, Catholic announced that it's not ethical because we destroy the life form. I also agree with that, but in the other hand, maybe I think most people would know that we have a lot of IVF clinics all over the world, and that we collect what we call blastocysts, and that being left over, how we don't use it. But the best we can do is embryonic stem cell can be done only for research, not for clinical application. Okay, after that I have heard about a lot of stem cell. Like when I went to Germany and Switzerland, they use stem cell from so-called fetal sheep cell. At the beginning, I told myself, not possible. If you're going to inject something coming from animal species, you probably have anaphylactic shock every time. To my surprise, it never happened. And I asked and understand why that stem cells have a unique property. They are considered to be so-called naive. That means they are easy to command and control. Okay. Later on, I also found out that if you collect something from the young cells, it doesn't have so much bad reaction. So I start to learn more that how about if I start from the newborn baby. That's why I start to say that placenta is an excellent tissue that can offer many stem cells, especially we call mesenchymal stem cell. When I look at placenta, I have been discussing with my good friend here as well. Even the same source, but they are different. As you probably know, we can collect stem cells from umbilical cord tissue, amniotic membrane, amniotic fluid, and maybe the placenta tissue, and they are not the same. So I think that right now, scientists, doctors, and patients must understand that even we talk about stem cell, they are not the same. Even they can come from the same source. Okay. I also learned that when I was very young, about let's say 6 months old, I have more than 100 times of stem cell I have today. So my idea at the time, which dated back 15 years ago, was if I collect my stem cell, increase more than 100 times, and put it back to me, what could happen? To my surprise, it helped me a lot. I actually become quite a bit younger and stronger and healthier. So my theory is simple, that if I can give so-called stem cell and even put it back to me, it can help to reverse my age in a certain way, which can prove by scientific data. However, I also found that each individual will not react and have this good response similar to me, even though we are, let's say, 60 or 70 years old. There are many 60 years old who look very weak and tired. So for that reason, I have learned now that on the average, if patients who are above 55 years old, normally their stem cells are not working well. So that's why for them, what I should do. So I look for the source of stem cell that called mesenchymal stem cell. And I realized that mesenchymal stem cell is something that I should move forward and work together with them. They have a few properties. First, it's easy to expand. And also, it can change into different tissue and organs to more than 100 tissue and organs, like brain, heart, muscle and so on. And it also have what we call immunoprivilege. That means it doesn't have what we call HLA, antigen class 2, with response for rejection. And to my surprise, they become the source stem cell that become universal donor. And it also have a very good immune suppression property if you have HIV or cancer. On the hand, if you have autoimmune disease like SLE, MS, they will suppress it. So that's why I fall in love with this kind of mesenchymal stem cell. So I just start with umbilical cord tissue we call water jelly. And I also realized that during my visit to US, I met one group. They start to collect the stem cell from baby teeth. And I thought that this another thing that instead of throwing away, you can keep it and culture them when you need it for your family. So I started to operate so-called stem cell banking. It has been about 12 years ago in Thailand and many countries around Asia. On top of that, I have learned that we do have the way to promote stem cell properly by law of respect. So what I like to tell you that most people will think that stem cell have not been approved. That's not true. Legally approved, if any government approves stem cell and say that this stem cell can do this and that, that means that their public hospital must be able to provide the treatment. So therefore, if I'm the Minister of Health, I will not declare approval of stem cell because that tied up that the government must be able to pay for it if it needs to be. Understand that? So I start to realize that the best way to bring doctors to come in, we have to look for the doctors who are a bit think out of the box. So that's why I met him.
He's definitely thinks
Because
we think outside the box, and we
We
So,
think outside the box so we don't
yes.
wind up in one.
So we start on anti-aging. Like several years ago, not many people care why you have to remain young, because you have to die. But I think now we can explain them that when you are young, at actually biological aging, you can remain active until the day you die. But if you don't take care of your good health, you can have stroke, heart attack, cancer, and so on. And what's going to happen if you have 7 Mercedes-Benz, but you have to lie on bed because you have stroke, for example? That's why I keep telling people that prevention is better than cure. So I'm one of the first group in Thailand, at least, to promote anti-aging. And now I like to share with you, which I could discuss with my good friend here. When I'm talking about anti-aging, it's not a good word because aging is a natural process. And immortality is a thing that should happen. So what I like to do is that instead of making people live longer, I add quality of life to the years that they have left. It doesn't make sense if you and I live up to 150 years and lying in bed all the time. So what I like to promote is called biological immortality. And I like to be what I teach people, to remain active until the day that I will end my life, whether it's 100 years old or 150, doesn't matter. I think that makes more sense. And I think that if you are allowed by God's will to live that long, I like to encourage senior doctors like myself to learn to give to the people. I'm 70 years old now. What I like to contribute now is to make health for the people, for the whole, every country on earth. What I'm doing it for the glory of God and for the benefit of mankind. And when I start to talk about this, I have a lot of friends to support me, because I think that it doesn't make sense to try to earn cash. It doesn't. When you die, you cannot take anything back. Mm-hmm. But what I'm trying to create now will be more on legacy. That even though after I die, I hope that my younger generation can carry on with the hope that we can work together. and also like the concept of medicine without border. That's why I enjoy meeting some of my foreign friends, whether they come from US, Germany, Switzerland, China, Korea, because I learn a lot from them. That's why it was exciting to learn a bit about what you're doing, because detoxification for me is a must. If I want to clean the house, first and fix it, that would be better than have a dirty house and I give stem cell. It never works. So that's why I'm thinking about holistic, and I've been discussing with a lot of my colleagues to make it happen. So that what I'm brief explain how I started with stem cell.
So you were saying that you noticed in your research that there was a difference between the cord and the placenta and the amniotic. Can you explain the difference that you noticed between those three sources of stem cells?
Okay. Actually, if you look under microscope, it have the same morphology. I mean, look alike. However, if you look in terms of the receptor or what will contain in there, it's a bit different. So I learned now that once we know how gene express in this kind of cell, we can select the cell. For example, some cells may be able to change into the brain. Some cells may be able to change to the pancreas. So that we can do the treatment in a better way. 15 years ago, I was able only to give stem cells to the patient and let them do the job. But once I start to have research, I know how to command them to go where I want without having invasive treatment. So therefore, I'm learned to use what I call growth factors that we can derive from the patient blood and mix with the stem cell in order to turn them into the desired organ to be treated. So they will go to the better homing and stay there longer. And also learn that stem cell doesn't only work by going and replace dying cell and tissue. The real effect of stem cell is called paracrine effect. That means that it's like a big pharmaceutical hub that give away a lot of good things when they travel around your body, like growth factor, cytokine. So sometimes you can feel much different right after the treatment. Like when I did it, I was able to sleep very sound, like when I was a baby. And I have some the shoulder pain, frozen shoulder a bit. After stem cell, even intravenously, my pain went away. And I learned that because it contains some cytokine that have immediate pain relief. So that's why we start to work with my good friend. We have one Australian partner I call him Bill, which is his nickname. We are able to now develop what we call proteomic therapy, use peptide and protein to make people look better, lose weight, or boost up immunity. So I think that we now do not have to concentrate only on the stem cell alone. And what we need to do is to keep up to become better. I don't want to compete with anyone, but I want to compete with myself. I think that's the way that I like to do. And I also believe that knowledge, you don't need to learn only when you go to medical school. I will remain learning throughout my life. And I also found that sometimes for brain disease, if I do acupuncture together with stem cell, it works better than using stem cell alone. And I learned now that your energy, called qi, can also induce stem cells for homing as well. So that's why I learned to become more holistic practitioner. And like I told you before, I truly believe that before you go to treat anyone, even with high-tech technology like stem cell, patients must take good care of themselves first. And I think for someone who listens to our conversation, the best doctor is yourself, not me. I only become your advisor, and I fully respect your preference. So sometimes if they want to drink a little bit, I just try to tell them that it's better to do it moderately, because no one can stop to be everything perfect. And that's why I think what we can do together will make people more happy. And being a Buddhist, I also believe in mind, body, and spirit. So that's why I start to add on meditation and visualization If I go to treat the patient, anyone, I will tell them that once I give the stem cell into their body, please visualize that it goes to change your organs. Like if they have liver problem or lung problem, let the stem cell help you. And when you think very clearly, it becomes true. And I also believe that sometimes prayer or maybe ask for God support may be useful even for terminally ill cancer. And I found that many of them can survive, even though they still have cancer, but they can live their life happily, rather than going for chemotherapy or surgery and then having the rest of their life in the hospital.
You've come probably a long way with your research. I mean, you're constantly thinking, you're constantly innovating. Like, what are you seeing next? What are you working on now? Because you've now have the ability to select for specific organs. What is the next stage?
Okay, it will be a lot of things that we can do, but here again, I learned the hard way that we have to be low profile because I do not claim that I can do a lot of things. But according to science, okay, what we can do is that we can do what we call therapeutic cloning. Okay, which means that each organ, we know the way to fix them. The science that have been advanced called IPS, developed by Professor Yamanaka. We can now doing this by get your skin, turn them back to so-called embryonic cells, and then let them develop into brain or heart and put it there. The FDA and most medical council, because they like to protect people, so they usually give us a break that we need to do a lot of research for them to be approved. But think about this, even though I'm a doctor who have seen a lot of patients, but I do not want to be rich. How could I afford to do the study to comply with US FDA clinical trial guideline? Because it would cost me at least $400 million to complete phase 1, phase 2, and phase 3. How can I afford it? And on top of that, according to US FDA, sometimes they put stem cell as a drug. I'm sorry to say, I do not agree, because how can you make the living cell and define them as a drug? That's wrong, because otherwise you have to follow the drug law. What I learned now that US FDA has also changed a bit. They are now passing the guideline for biological products. So what the lab like me needs to do is to say that what kind of stem cell we have and how many millions, and how we can prove that they are free from contamination and they are still active. So that's the way to go. And sooner or later, you will see that there will be a lot of approved products coming along the way. However, if you spend too much money on development, the cost of product will be too high. I give you one example, probably you have heard about it. It's called CAR T. It's a stem cell or immune cell that can treat cancer. The minimum cost will be $1 million per a course of treatment. How many people can afford it? So the way I think that I would like to do for Southeast Asia, and also I have a dream to help Africa. For the Western Europe or US, Canada, they are very strong, and they have a very strong FDA control, and they have also a lot of high facility to treat the patient. But think about country like Tanzania. Okay, even the proper standard healthcare, it doesn't available. It's similar to Thailand 40 years ago. So I think that why I have to spend my time fighting against other groups in developed countries. So I move myself away to smaller countries like Africa because they need me. And I also very happy to help them. I think Dr. D will agree with me that the doctors like us doesn't care too much how much they pay for us, but we are happy that we save their life or we make them become more active. That's what I find that my happiness comes from that.
So what do you foresee that you would like to do in Tanzania? Like, are you going to do blood-derived stem cells, or are you going to do the
Okay.
mesenchymal cells, and how do you feel that you're going to help the people of Tanzania?
That's very simple because, like I told you, I have come to think about the way that when I did practice when I was 40 years ago, I bit demanding. But now when I go to any countries, I beg for their support. I'm not going to tell them that, look, you have to listen to me. I tell them I just have an idea, which may be useful to you, but I need you to do it. So they start to learn to like me. And also target the disease that commonly in each country first. Like in Tanzania, they have very high incidence of sickle cell anemia. So when I talk that, what if I can help with sickle cell anemia? And they are now asking me, can I prove it? I said, yes. So if you agree, I can start with clinical trial for them. And that's what we will to do. As you know, they also have a high rate of HIV. So that's why we are thinking of using not stem cell, but some supplement that occurring in nature called quercetin that can be given intravenously. And I was really surprised that the results are quite effective. About 10 times injection once a week, 70 or 80% of HIV virus load will come down. And I think that even be better than use antiviral drugs and so on. I also come across with a disease called albinism, like white skin. When I learned about this, I think, what's wrong with that? If you have a white skin, you just wear sunscreen. But to them, it's different. In their society, these kind of people, they become discriminated for some reason. So I think that they need help. So that's why I spend my time to support them, which is a local problem. And I can tell them that if I will not come to support them, nobody else will, believe me. Because most people will look for the big market, big volume patient, or more serious diseases. So that's what I learned. And when I went there, I do believe that I need also to preserve the natural environment. I enjoy watching safari. To my surprise, the number of giraffe, rhino become down and down. So that's what I will propose, the method called cloning, which is not possible for human. But cloning for animal has been accepted. So I can bring more animals to roam freely in safari. That's what I like to do. And also like to learn more on diet. I promote more organic farming there. Because I think you are what you eat. We should not neglect that. So that's why we learn a lot to exchange ideas and then form. I also tell my good friends there, who are my investors, and some of them are political leaders, that you should not allow the gap between the rich and the poor to be too high. I recommend that what I'm doing will be more for social enterprise. And they happily to allow me to share about 30% profit for whatever I'm doing there and put it back to the public, but not give free money. I like to train them and educate them. Like they will need to develop nurse aid for taking care of old people. So they can look after their family members or their people who live around there, and they will get more paid because they like become a nurse practitioner. And I also like to train them in many areas like organic farming and develop something even in the future. I'm planning to promote the production of hemp internationally because I think hemp is a better term than marijuana. And hemp is free of THC, which have addictive potential. And also learn the word biodiversity. So I start to promote now the concept of probiotics because, as you know, our body are being controlled by bacteria. So why not invite only good bacteria to come in? So I learned to study more on how to use good bacteria to help people. One of the projects that I will have him to take the lead will be I developed one of the bacteria called Bacillus subtilis, and for some reason it helped people to lose weight, amazingly. But you have to do it, test for me whether it's true or not. So that's the kind of idea that I like to put everything, not only focus on stem cell, but telling them that it's about time that we have to combine every modality of treatment together for the benefit of the patient. And also think about the way to help their healthcare costs by talking about medical insurance scheme or some of the government support. And I was strongly supported now by some of my rich friends. They are setting up some foundation for me. And they told me that, Dr. Kampon, if you have a good vision and help people, they're willing to give me the money to run the foundation. So I now probably have some money, not for myself, but if I want to treat the poor people, I will have funding to support them. So I think that will make me be able to do more. And I also like to tell you, actually, Dr. D, that even though we are a doctor and need to do good things, we will need someone like you to help other people to know about us. I do not want the patient to come to me, but I would like to have the chance to offer them the advice. I usually do not charge for my consultation because I think that by giving knowledge, I get a lot of things back in return as a merit. And I think that by having something that we do it, we should be able to do for the long run. That's why I like to have the network to help me to carry on the good idea. And because we have the foundation to support it, I think that's going to make it run very far and very long time.
I think we all, the good doctors, have the desire, and we know that we're born to help society. Mm-hmm. And a lot of the work that we do is free of charge. I mean, we still give so much more than we receive a lot of times. And that kind of separates. And for me, it's all about giving back. It's all about, the reason why you're here is to help people. I look at so many people that are upset in their jobs. They're angry. They're holding on to these. They hate their jobs, or they're in jobs that are doing damage to the world, or damage to society, or damage to people. But being able at the end of the day to go home and say, I helped change somebody's life today, I mean, to me, that's one of the most rewarding things ever. I mean, that's God's purpose for us.
Right.
What do you, like, how would you define someone who has never heard about stem cells? Like, what would be the definition you would tell them a stem cell is?
The stem cell is the beginning of life form, but you can have many type of stem cell because of the location. Similar to the seed that you produce under the ground, it becomes the whole tree, and that is embryonic stem cell. Now, when the branch expands, you can have some stem cell which can act differently, but all stem cells do have different properties. You have to learn for it. One of the obstacles that most people do not understand, and they promote that stem cell may cause cancer. Okay, nobody can say certainly that it will not cause cancer either. But what I can tell to the rest of the world that cancer never being caused by single treatment. It's so-called extra genetic, and it's caused by environment, not only stem cell. And also, if you select the stem cell properly, it will never cause cancer. But if you make the stem cell that have a lot of potential to multiply, they become almost immortal. That may cause cancer. So if you learn to choose the stem cell properly, you don't have to worry about the side effect or carcinogenic potential. On the other hand, the good stem cell can also protect cancer by boost up your immune system to fight back against cancer. And also learn a new term that I think most people already know, called apoptosis. That the reason that cancer cells do not die because they do not have a apoptotic program. So what I'm learning now is to convince them to die by induced apoptosis. And I also found out that these apoptosis cells, they are not dying yet. To my surprise, in your heart and your kidney, even though you have heart problem or kidney problem, many percentage are apoptotic cells, which can be awakening. So what I have started to develop with my US and New Zealand colleague, we work on chaperone protein, to use chaperone protein to reverse apoptosis. And that's very useful for kidney failure and heart failure. And that, I think, what I'm learning now is how nature heals itself. And what I like to do is not try to make it like the new breakthrough. Is not, nature already provide everything. What I need to learn is to understand more about nature. And that's why I learned to collect some good thing from bacteria or good thing from some other species to be used on human.
If someone was searching and someone watches this video and says, I want to get stem cells, but even here in Thailand, you know, we're not allowed to mention anybody's names. You're not really allowed to say stem cells. Is it the same way all over the world right now? And why do you think that is? Like, why are we not allowed to talk about stem cells and tell people where to go?
Okay, I can tell you that one thing that I need to do, and you can support me a lot, by education. I'm also, with Dr. D, we have run many workshops for the doctors to tell them about stem cell. To my surprise, even though they are excellent doctors, most of them do not understand even what are stem cells. So when we have these kind of doctors being trained, they understand more, then they start to use it in their practice. That's what I'm doing now. Now, for the general people, I will tell them that it's human right, that they must have the ability to access to information. I do not worry about any authority, because what I'm telling them is a technology that I believe in. I do not convince that you must believe me and come to be treated by me. I will just tell you that give your body a chance to consider stem cell to be useful for many diseases that you may have. And I also can advise them. They don't need to come to me. I know that which country, which doctor are good for that. And I also have the same feeling with Dr. D that we are not able to treat everyone, but we have many friends and we can have the right choice for the patient without bias. That this doctor can treat well with cancer, for example, or this one can treat stroke patient very well because he's knowledgeable. But I think what I like to have a lot of doctors to follow me and Dr. D and many others, to be able to educate, give advice. And we can do whatever we think we best can do. Like what I'm discussing with him now, he will plan to do, which is a big market, to make people beautiful, lose weight, and have more sexual power. That's enough to win connection. And the way that I follow up with him, if he can make ED to be improved, I can tell his patient that, look, if he can wake up your penis, we can also wake up your brain or your heart. So that's the angle that I'm trying to tell them, that instead of trying to convince them too much, I'll tell them that we can offer them some treatment that they can be happy. And we do not talk about stem cell. We use the word rejuvenation. Mm-hmm. And I think that rejuvenation is a vague term, but it's okay by most of the medical authorities. And that's what we can do.
How often do you get stem cells? I mean, do you experiment on yourself and
yes.
do you inject? Because you look really young and really vibrant and full of energy. And I think
for 70, yes.
Listen, one of the biggest complaints in the United States is fatigue and lack of sleep and stress.
Even though doctors, but when I first start to promote something new, what I did tell them is that I start on myself first. So before the type of stem cell that I tell for anti-aging, I give it to me first. And also, I take care of all my brother, sister, and my loved one. My parents were dead a long time ago. Otherwise, I put them on stem cell. So that, I think, going to be my backup for my belief system. And honestly, I can tell you that not many doctors, they dare to give themselves the treatment or their loved one. That's what they are giving to the patient. So that's what I pass my conscience. Okay, with that, I also put that we need to do research. I cannot just say that stem cell, you get it. Now I can tell you everything. Why stem cell will be useful for you, how it works, and how long you see the result. For example, if you have liver problem, I can tell you that you'll be better within 6 weeks. If you have skin problem, about 4 weeks maximum. If you have large intestine problem like Crohn's disease, ulcerative colitis, it can be better in 5 days. However, if you have kidney disease, it will take at least 4 months to have better creatinine function. Or if you have brain disease, that may need at least 4 to 6 months or more, because each organ repair itself differently. So that's why I do not give false hope. And I've been talking to Dr. about diabetes for some time. The thing that the public must learn, that even though we use stem cells to treat their diabetics, that they must also learn to control their eating. Many of my patients, when we give the treatment, they go and celebrate. In that case, they cannot blame on us because they are doing something bad for themselves. They must control something. However, without stem cell, even though they control diet, their sugar will not be normalized. So that's what I tell them.
So there's doctors in the United States that are selling stem cell injections, and they're doing it, say, you can purchase 5 million cells, or you can purchase 10 million cells, or 20 million, and usually it's in increments of 5 million. Is there a minimum number that you've noticed to be injected or intravenous that is like a minimum effectiveness number?
Okay.
What is the difference between the amount of
First,
cells?
most of the general doctors, they would not know. When you talk about stem cell numbers, it depends on how many passages that you grow in the test tube. Suppose I take your stem cell today, I expand it 12 times, it becomes billion cells. Okay. However, that billion cells are not effective because they are getting old. Understand? So what I do is that I use only 3 passages, maximum be 5 passages. So my stem cells are really active, more than you expand it 12 times. So when they talk about number of cells, please check with the lab how many times they culture or passage. Mm-hmm. It's really different. And general rule of thumb, 5 passages will be the best or below. And if you keep on multiplying it, not only you have a weak activity, you also can get what's called mutation. So therefore, never use stem cell that has been expanded too many times.
And they say that? Like, how do you know?
Yeah, because the lab never tell. But I'm telling you now that that's what the message that we need to learn from the lab.
Is it possible to purchase stem cells from your lab and ship them to the United States?
Well, that can have to follow the rules and laws. What I usually start off will be more on research purpose, because I really like to promote research at the beginning. And believe me, even US FDA, if they have some good doctor doing proper clinical trial for them, then they will approve it. Like what they have approved many things, like orthopedic now. I think orthopedic doctor in US now, they start to use a lot of stem cell. And I think that's the way that we should go. But on the other hand, you have to learn to protect the viability of the cells. So just to make long story short, I prefer the lab to be situated near the area to be treated. So if I set the lab in Thailand, I would like to serve only AEC countries. And I also have the lab in Germany. If they need it, they can use it for Europe. And also I have the lab in Japan to cover Japan, Korea, and something like that. So that I think we need to maintain the quality by not making them too far, because otherwise cell may die. And other thing that we need to do is learn to make the price cheaper. So what I'm doing now, I'm helping my partner all the world to gain more patients, and the price will come down, because the cost of setting the lab will be the same, whether you produce 10 sets a month or 100 sets a month. So that's what I like to educate people. That now, for those who are dying, I like to tell them that you have the right to search for the treatment that you think is good for you, because you don't need to listen to any authority. If you have cancer, terminally ill, and you are dying, and you go to the conventional doctor, they say, I cannot help you. I don't think they can stop me if I have that problem to seek for any treatment that I think it may be useful for me. So I think that will be for under compassionate use. And if I see young children with cerebral palsy, they will spend the rest of their life being like that. What is it worth to live? Many people ask me why I dare to do stem cell for cerebral palsy. I told them that if they are your son or your daughter, would you like to remain seeing them like that? If you like to do it, I follow you. But I think most people will not do. So that's why I also use the word compassionate use, where conventional medicine fails to help you. And I will be the doctor to give you support. Like I said, it doesn't have to be me. I can refer to the doctor who can give them the chance to survive.
Have you ever seen a complete reversal of Down syndrome using stem cells?
Yes and no. Okay, depending on the timing. I can tell you that if we start the treatment of Down syndrome around 2 to 4 years, the chance of reversal will be very good. So we have now learned that according to what I call stem cell medicine, that which type of patient, for example, for kidney failure, for those who have the GFR greater than 20 ml per minute, the chance of reverse will be very high. But if you have GFR less than 5 ml per minute, the chance of reverse back will be very poor.
Even with multiple
Yes.
treatments?
Yes, so we know some predictor the success of the treatment. So that's why I also believe in advanced tests like gene tests and some tests that can give me more answer. Mm-hmm. Because if you give something that you expect the result, you must be able to prove it. And I also like to prove about aging. What I'm studying now, most people will talk about telomere, but I think I will introduce the word cell-free DNA. Cell-free DNA is when your cell die, the DNA will float around your plasma. So the more cell-free DNA you have, that means your body cells are dying. So I have been using this very accurately to prove that I remain younger because cell-free DNA become down. Something like that. We have to work on the markers of aging that I think it needs to be certified. Otherwise, I cannot convince conventional medical doctor group. And also learn that even immune tests, they check white blood count, lymphocyte, everything. But none of them is able to put in the perspective that what's wrong with your immune system. So I met one of the Japanese researchers. He has a good idea. We are promoting very soon immune tests. What you need to do is send the blood, and we will tell you what's wrong with your immune system, whether you have too low, too high, or you have a risk of cancer or HIV. Because what I like to know is that we should be able to use the information correctly and compiling it. In the future, this is probably the last comment that I like to share today. I like to have the doctors, it doesn't have to be me, who have a lot of knowledge, to be put in computer, which I call AI, artificial intelligence. I tell you my feeling. If I teach the younger doctors, they may be able to remember only about 20%. As time go by, their memory will come down. But if I have computer who become AI for my Dr. K, they will always remember. And then they can distribute information more effectively. And they will forget. So that's why I think that I'm planning to use the technology to come and support my legacy. Because, one of these days I have to die.
I just have one more question, if you don't mind, and that's USC did a study with fasting patients for 72 hours, and they saw immune stem cell production in 72 hours on a water-only fast. The question is, do you believe that stem cells would be more effective if patients were to go through a detoxification process, a cleansing process first before they receive them?
Definitely. However, I have to tell you that because the patient do not used to the job that they need to do, so when they come to stem cell, they used to think of a fixed idea that they rely on the Kampon, and they don't care. So right now, I'm forcing them that before you come in to do stem cell, you must clean up yourself first. If you have too much heavy metal, why you have to do it now? I just told her that, look, about you have 2 swimming pools. The one is nice and clear. and the one is dirty, which one you are to jump in? I told them that if you make yourself good quality, my stem cell will go there. But if it's dirty, stem cell will go and die. So, but it takes some time to convince them, because we will need them to understand that they also have the duty and responsible, not my stem cell. Because if they don't treat themselves well, the stem cell will die very soon. So I told them that after they do stem cell with me, how long it lasts depending on them.
So even after the stem cell treatment,
Yes.
try to avoid alcohol, toxic food,
As much as I
try
can.
to be as healthy as possible, very low stress, and for 3 weeks, 6 weeks, as long as possible, really, right?
Yeah. And then I can tell you that if they do stem cell only without adjusting their lifestyle, the stem cell effect will last only about 1 year. But if they do it perfect job, the maximum I have seen is 7 years. That save a lot of money and save their quality of life as well. So it's worth it.
Do you have patients that get stem cells every year? Is that a good, or should they do every 2 years, depending on their lifestyle?
Like I told you, sometimes if you put them to rely on too much technology, it'd be good for your business. However, I like them to be able to control their lifestyle. So I tell them that consider to come whenever you're starting to run down. So I don't recommend them to come too often. Even though, according to the study, stem cell is very safe. You can even do it every 3 months if you want.
Wow.
But I don't want them to happen. And you know why? Because when your body have too much stem cell, they will wash away. So it will be wasted. But the more you give, if it's extra, they will wash out.
I see.
But I want to save the cost as well.
Well, thank you so much. I really appreciate your time, sir. And we all are very proud of you for all your accomplishments and everything that you've done to change the world and to bring stem cell technology to where it is today. And I can only imagine, I hope you realize all your dreams, and hopefully we can help bring that information out to the public. So thank you.